Good day everyone, I am Andrea Somoria, a first-year nursing student from Our Lady of Fatima University. So for today's video, I will be performing a return demonstration for the assessment of the abdomen. So the first thing we want to do is to identify the client or the patient. So we have to first identify the client or the patient in order to ensure that the client's identity will match with the correct treatment, or to ensure that the clients will receive the service and procedure intended for them. Good day, ma'am. I am Andrea Somoria and I will be your student nurse for today. Can you kindly confirm your name and your birthday?
I'm Edita de los Santos Somoria. My birthday is October 17, 1970.
And how old are you, ma'am?
I'm 52 years old.
Okay. So, Ma'am Edita, I will be your student nurse. So, I will be assessing your abdomen. So, we do this assessment to ensure that everything is normal in your abdomen. But if I have noticed any abnormalities, I will note them for further evaluation and observation and to prevent any further complications. So, also remember that if there are any doors or any curtains, we have to close them in order to provide a privacy for the client. So, ma'am, do you have any questions so far? May question po ba kayo?
Wala.
So, before we proceed to the actual procedure, meron lang po akong konting questions. So, meron po ba kayong abdominal pain?
Wala.
Nag-gain po ba kayo ng weight or nag-lose kayo ng weight? Do you have previous abdominal surgery, trauma, injury, even medications?
Wala.
How about po previous abdominal pain or kung may treatment po dito?
Wala.
Sa stomach po and colon or liver, meron po ba kayong cancer? Meron po bang appendicitis, colitis, bleeding, and hemorrhoids?
Wala.
Who is the person responsible for nutrition sa family po?
Ako.
Do you smoke, ma'am?
Hindi.
How about alcohol?
Hindi rin.
Gumagamit po ng antacid?
Hindi.
Ano po or nag-exercise po ba kayo?
Hindi.
So, meron po ba kayong stressors at ano po yung mga cause ng stress niyo sa buhay?
Anak ko. Pera, yun lang.
Nakaka-apekto po ba ito sa pagkain niya?
Hindi naman.
How about po kapag nagdudumi, nahihirapan po ba?
Hindi.
So, okay. Meron na po ba kayong questions?
Wala naman.
So, pag may questions po kayo, you can just ask me throughout the assessment. So, before we proceed to the actual procedure or assessment, I will be first performing a proper hand hygiene by applying alcohol sanitizer in hand. So, assessing the abdomen consists of inspection, auscultation, percussion, and palpation. So, we'll now proceed to the first part of the assessment, which is inspection. So, I will be putting my gloves on. So ma'am, I'll be asking you to lie down. Is So now I will be inspecting the skin of the abdomen to note the color and to observe the texture and the temperature of the abdomen. And also look for scars or if there are any lesions, rashes. Next is I will be inspecting the umbilicus of the client to note the color and its location, which is normally it should be in the middle at the lateral line. And also note if the umbilicus of the client is recessed or protruded. So next, I will be assessing the contour, symmetry, and movement of the abdomen. So to assess the abdomen contour, I will be observing the client's abdomen by looking at it at eye level from the side and to the foot of the bed. So as I have noticed that the client's abdomen is rounded. And next, to assess the symmetry of the client's abdomen, I will be looking at the abdomen of the client as she is lying in a supine position. So as I look at it, the client's abdomen is symmetric. Last is the abdominal movement when the client breathes. So observe the abdominal respiratory movement of the client. Okay. We can also observe the aortic pulsations visibility, but usually it only seen from thin people. So now we'll proceed to the second part of the assessment, which is the auscultation of the abdomen. So first, I will be auscultating the vowel sounds of the client's abdomen to note the intensity, pitch, and frequency. So I will auscultate each side or part from 1 minute each. So we'll start from right lower quadrant, proceeding to the clockwise pattern. Next is I will be auscultating for the vascular sounds and friction grooves to listen for any roots over the abdominal aorta, renal and iliac, and then femoral arteries. So to do this, I will be using the bell of the stethoscope. And then next, using the bell of the stethoscope, I will be auscultate for venous hum in the epigastric and umbilical areas. And we'll now proceed to the third part of the assessment, which is the percussion of the abdomen. First is I will be percussing the abdomen for the tone. So next, I will be percussing the liver of the client. So ask the client to take a deep breath and then hold it while you percussing the abdomen. So ma'am, take a deep breath. Hinga po malalim. Hold. Release. And then measure it from the victims. Next, to assess the descent of the liver, we will be asking the client to take a deep breath again and then hold it while you're percussing it. Then just repeat the procedure. But we'll start from the upper right chest of the client at the MCL and then percuss it downward. So ma'am, take a deep breath again. Inhale, hold, release. Next is I will be performing the blunt percussion on the liver and the kidneys to assess the liver for tenderness. So I will percuss the liver by placing my left hand flat against the lower right rib cage and use my ulnar side of my right fist to strike my left hand. Do you feel any pain or tenderness? Do you feel any pain? Next is light palpation of all quadrants to identify the areas of tenderness and muscular resistance. So we'll start with the right lower quadrant using the fingertips only. So we'll do light palpation. Inhale. Then we proceed to the deep palpation using my two hands to note or to palpate, delineate the abdominal organs and subtle muscles. And also note for any pain of the abdomen. Next is palpate for the umbilicus and the surrounding area to note for the swelling, bulges, and muscles. And the next palpate for the aorta. So I will be using my two hands and palpate deeply at the epigastria. Next is I will be palpating the liver at the right lower quadrant using my left hand. Next is I will be palpating the spleen at the left upper quadrant. I will be using my two hands. Next is I will be palpating the kidneys on each side using my two hands. Next is I will be palpating the urinary bladder. So palpate it for a distended bladder. Next is we'll now proceed to the test of shifting dullness to note for the changes of the dullness. So we'll start from the side up to down midline. Next is I will be performing the fluid wave test to detect ascites. So I will be asking the client to place their hands like this. And I will be using my two hands on each side. Then slightly tap the other. Next is the ballotment test to identify any mass or enlarged organ with an acidic abdomen. So I will be using the manual method. notice that there is no any mass or any enlargement of the client's organs or abdominal organs. Next is test for appendicitis. So first is the rousing sign. I will be applying pressure to the lower left quadrant of the client. Do you feel anything? So the scene, it is a negative for rousing sign. So next is this SOA sign. I will be asking the client to lift their right leg. So it is negative for SOA sign. Next is for the obturator sign. So I will be asking the client to move aside and touch the hip and the ankle. Okay. So lastly, test for cholecystitis or Merpes sign. So I will be assessing or palpating the liver. So I will be asking the client to take a deep breath. Inhale. Inhale. Exhale. Okay, so it's negative for the Merpes sign. So that's the end of the assessment of the abdomen. So if I have note any abnormalities of the client's abdomen, so I will refer them to the other healthcare professional for further evaluation and observation. And that's all. Thank you.